Hey everyone, welcome to the International Conference of Urban Health. My name is Robin, and I'm the host of the Good Place Bench, which is the place to share stories and to share amazing projects. And today I'm joined here by Alberto. Gracias por todo. Thanks for joining. My Spanish is not that good enough that we can completely do this interview in Spanish, so we slowly do this in English. Tell us a bit more, Alberto. Where are you from, and what brought you to Marrakech?
I am from Colombia. I am medical doctor and I work especially about topics related with infectious disease. Especially, I work at the University of Antioquia in Medellin, and principally I work with malaria problem. Malaria is a very big problem for the public health at global level. In Colombia, is public health, and in this meeting, we will speak about malaria in the cities because this is a problem that growth and growth in the cities because the migration of population, the migration of vectors too, and I think that the authorities are not prepared for resolve this problem.
It's interesting, because when we talk about malaria, it's mostly related to Asia, Africa. You don't come to mind that malaria is also in Colombia.
Uh, the principal focus of malaria in the planet is Africa, but Asia and South America are focused from species of malaria named Vivax malaria.
Okay.
In Africa predominate falciparum malaria, but in Asia and America predominate Vivax malaria. For us, it's very important, especially in Brazil, Peru, and Colombia. We are the most quantity of case. This is a sick, especially in the rural areas and in the population that are near the forest.
Okay.
But the human migration and the population that works near the forest, for example, minery,
In a minery, like working in a mines.
minery,
Yeah.
deforestation, etc. This contact between the human and the vectors, this contributes to the malaria. But also, the population that live in the cities are exposed actually because the vectors are attracted and because the persons go to the rural areas and transport the parasite to the neighborhood.
Wow. And what do you do to prevent it,
To prevent it.
to fight it?
Uh, this is a very complex problem because malaria is related to work conditions, the occupation is associated with housing, the housing condition, the access to the health service, and other conditions. But it required an integral solution.
Because as a medical doctor, you only, of course, cure people mostly, right? I mean, vaccines do exist for malaria,
Yes,
but you also need to prevent it.
we have especially two vaccines that are useful and are used actually, but are not used massive amount. But we have some years for use these vaccines, I think.
One other thing you address is language, that it's important that this message is also be communicated in Spanish more because more people need to know about it.
Yes, I think that the research about these topics are published especially in English, and many information don't reach the person that work at the governments, at the municipal level, for example, for the authorities, and they don't know these studies, this research about this problem, and I think that many solutions are in English, and they don't know because they don't understand this language. And I think would be very important to publish many research, many investigations in Spanish and in the local level. For example, I think would be in Africa in French or in other language.
It's interesting. When we talk about urban health, we can come up with the best vaccines. We can talk about prevention, but language is just as important for urban health.
Excuse me.
La idioma es muy importante por urban health.
Sí, es muy importante.
This was my best Spanish I could offer. And what are you aiming to find here at the international conference?
To connect with other professionals that work in other areas. Public health is have many challenges that will be resolved with many different knowledge and ideas. For example, the work between engineers, architects, physicians, etc. This is one explanation, and you have the opportunity to know the work that is developed in other countries for the public health.
So it's also about exchanging knowledge between countries and cities, and maybe they could help you as well.
Please explain, please.
Maybe there are solutions that could help you as well in Colombia.
Posiblemente hay soluciones que estamos implementando. Es como tu pregunta. I think that the solutions I don't explain, it's difficult to explain this. I think that the new solutions may be the interdisciplinary work. One can see different professionals at the government programs, and I think that these interdisciplinary groups is a actual situation that promise a better solution.
So it's also important to have these kind of conferences.
Yes. It's very important. I think that here we can mix the person that are at the government programs and the research institutions and the financial institutions.
Feels like a community already. Comunidad.
What about
This community of urban health professionals is good. It's important.
Yes, yes, it's very important. It's necessary work together.
Last question. A pregunta finalmente. A good place. What is a good place for you? What is you dream of in the world? What's that good place that we need to work for?
¿Cuál es el lugar, un buen lugar para estar o para
Sí, a place for you is your happy place. What needs what do we need to do to make this world a healthy place?
a healthy place? Are this place where the people has the basic needs for the daily life. For example, nutrition, housing, and job, etc. But good condition and reduce the difference between the population, the reducing the gaps between one group and another group. This is a good place.
Let's work towards that. Thank you so much for your time. Gracias, señor.
Muchas gracias.
De nada. And good luck this afternoon with your session.
Set.
¿Sí? Gracias a todos.